Hey guys, Jim Hoffman here from EMSSEO.com, and in this video I want to just quickly review a very common call type in EMS, that difficulty in breathing patient. But I want to kind of drill down a little bit and focus more on the differences between things like CHF, congestive heart failure, and pneumonia. So I want to give you some key points about the symptoms of CHF and pneumonia, so that you can kind of identify them when you're treating patients, assessing patients, and of course even when you're taking exams. So CHF patients, these patients commonly experience things like orthopnea. This is that difficulty breathing when they're lying flat, right? It's a lot of times they feel better when they sit up or they elevate their head, right? Maybe they have one of those beds that the head goes up, or they use pillows. Another one that you'll see these patients experiencing is the paroxysmal nocturnal dyspnea. That's PND. I like to use PND because I don't like to say all those fancy words. But this is a sudden episode of shortness of breath that makes the patient wake when they're sleeping, right? They just suddenly wake up from sleeping. And this often requires them to sit straight up or even get up and stand to catch their breath. Another thing with these patients you're going to see is that edema, that swelling, especially in the lower extremities, in their feet, their ankles, and their legs, due to that fluid accumulation that's going on for these CHF patients. Now, what about pneumonia? Well, it can be tricky to tell the difference between the two of them, but with pneumonia patients, some key things you want to look for is a fever. The patient's going to have an elevated body temperature as a response to that pneumonia and that infection that the patient has. A patient with pneumonia might say they're feeling chills because of that fever, right? They're feeling cold, they're shivering, and that goes along with them having that fever. Another thing with patients with pneumonia, they're going to have a cough and they're going to have a sputum production. So that persistent cough that they have is going to produce that mucus, that phlegm. It can be clear, it can be yellow, it can be green. It might even be blood tinged because they're coughing so much that they're breaking some little blood vessels in their throat and they're coughing up that blood. You might even get the call where they say patients coughing up blood, right? You might get that internal bleeding call. But when you get there and you assess the patient, you figure out, oh wait, they've got pneumonia, they've been coughing a lot, they're coughing up that blood-tinged sputum. Another thing they might complain of as well is chest pain. You may get a call for chest pain, but it's really pneumonia because they've got that discomfort or pain in the chest that may worsen because of the difficulty breathing. They're breathing in deep, the pain gets worse, or they're coughing and that's making the chest pain worse as well. And this is often due to the inflammation the patient's got of the lung tissue or the pleura, that lining of the lungs. So these symptoms, guys, like I mentioned, when you do a good, thorough patient assessment, you can differentiate what's going on with these patients between CHF and pneumonia. When you're responding to these calls, keep these key elements in mind so it'll guide you where you need to go and how you're going to treat these patients. You got to remember, we're the professionals, right? Our goal is to provide the best possible care to our patients by utilizing our skills, our assessment skills, and our clinical judgment. Very important, having that clinical judgment. Now, that's really it for today. I want to close it out, but listen, I talked about some differential diagnosis stuff, right? I want you to go and download my free guide, the differential diagnosis guide. It's called Your Patient Didn't Read the Textbook. You can download it. It's free. Just go to emscalls.com and you can get it there for free. And I think it'll help you also differentiate a lot of other common EMS call types that we get that's going to help you be better at EMS and be a better EMS professional. That's it for me, guys. As always, I'm Jim Hoffman from EMSSEO.com. Stay safe.